afternoon, everyone, and welcome to the series, Ending Deaths from Despair webinar series. My name is Carla Gaines, and I am the co-chair of the African American Opioid Coalition of S.A.V.E Communities and the MC for this series. I am pleased to convey this webinar series to our knowledge. It's the only one of its kind in the nation. So on behalf of the Dane County executives, Ending Deaths from Despair Task Force, we thank you for joining us and for being a part of the solution. The goal for this webinar series is to save lives in Dane County, to help set a standard for communities around the nation grappling with deaths from despair, to understand what underlies these deaths from despair from the perspective of people in pain, and to provide tools to all helpers who are working to prevent them, to lay the groundwork for continued conversation and action on how to make Dane County's mental health and substance use disorder treatment systems accessible, culturally competent, and effective at eliminating all deaths from despair. So today's presentation of the series is entitled S.A.V.E, Veteran Suicide Prevention, presented by Andrea Bailey from the Williams S. Middleton VA Hospital. Andrea is a licensed clinical social worker and the lead suicide prevention coordinator at Memorial VA Hospital and clinics, working to reduce veteran deaths by suicide through provider and community education, implementation of best practices in suicide prevention, and clinical case management of veterans identified at high risk of suicide. Andrea's previous work in crisis intervention with Journey Mental Health Center, first as a mobile crisis responder, and then as a clinical program manager prior to her work with the veterans. She is passionate about suicide prevention and committed to empowering all in the community to recognize the role that each of us can play in saving lives that might otherwise be lost. Also today, we have Mary Lawby, is the Injury Prevention Coordinator for the UW Health Level 1 Adult Trauma Center and is a member of the Ending Deaths from Despair Task Force. And she will work with us during the presentation in gathering questions from the audience. So thank you for participating today. We look forward for your continued education, and please enjoy the webinar.
There we go. Thank you so much for the introduction and for the opportunity to speak today in this very important webinar series. I'm hoping to impart today some information about veteran suicide prevention that will help us all to understand better how we can do our part to help end veteran suicide. The training is called S.A.V.E, and I'll talk to you more about what that stands for a bit later in the presentation. First and foremost, want to acknowledge that this is a difficult topic of conversation. It can be a very intense topic for many people. Invite you please to take care of yourself. If at any point during this webinar you feel the need to take a break or step out, I invite you please to do so. I also want to make sure you're aware of immediate resources that are available to you should you need some additional support. We have, of course, the National Suicide Prevention Lifeline number, which is a 24/7 crisis hotline number. You can reach that lifeline number at 1-800-273-8255. If you are a veteran or a military service member or calling regarding a veteran or military service member, you'll be prompted to press 1 to connect with the Veterans Crisis Line through that number. We also have a wonderful resource here in Dane County for crisis intervention with Journey Mental Health Center. So I've provided the crisis intervention phone number there as well, should you need support, 608-280-2600. Next, just an overview of what to expect today. We have some objectives for the training. I'll discuss facts about veteran suicide, provide some data, go over some common myths versus realities, and then the VA S.A.V.E training steps, and then finally make sure to leave you with some resources that are available to veterans and community members regarding veterans. Our objectives are threefold. By participating today, listening in on this webinar, our intention is that you will leave with a general understanding of the scope of veteran suicide within the United States. Secondly, you will have a better understanding of how to identify a veteran who may be at risk for suicide. And then thirdly, know what to do when you identify a veteran at risk. Have some ideas about next steps and resources available. So we'll start with the data, and I want to provide you with some facts about veteran suicide that you may know or may not know. And we'll actually start with suicide overall. Suicide is considered a national public health problem with rising rates of suicide in the general population across the span of several decades. As evidence, the number of suicides among US adults has increased from just under 30,000 in 2001 to over 45,000 in 2019. This number also does include over 6,000 veterans in 2019. And the reach of suicide is of concern as well for our communities and the wellness of our communities. It's estimated that for every one life lost to suicide, 135 individuals are exposed. And exposure to suicide certainly can be a risk factor itself for suicide. After studying this for several decades at this point, we do also understand that suicide is a complex issue. There is no single cause. Oftentimes it's multifactorial. It's a complex interaction of different risk and protective factors, both within the person, within their community, and within our society overall. Risk factors are what we consider to be characteristics associated with an increased likelihood of suicidal behaviors, and then protective factors are the factors that help offset those that create the risk. And to prevent veteran suicide, our goal and intention is to maximize protective factors as best we can while minimizing risk factors at all levels and throughout the communities nationwide. And VA healthcare system and the Veterans Administration is committed to doing what we can to provide additional resources and opportunities to help maximize those protective factors. Now, risk and protective factors, there are many of them. This is a list of just some that have been commonly associated with individuals who have presented with suicidal risk or behaviors. So as you can see, there are certainly issues related to risk that are related to mental health or substance use, prior suicide behavior, but also things that are more about how a person is functioning in the community. So maybe not necessarily a mental health issue per se, but could be legal, financial issues, losses, which could be losses of relationships, loss of functioning, health related, homelessness, and then access to lethal means and sort of the ability to act on those thoughts. And then protective factors are really those things that keep us grounded and connected to our community, to our families, to this world, but also things like access to appropriate care, access to a mission or a purpose, and also having the other parts, not just our mental health attended to, but also our physical health and our social and emotional well-being, our spirituality. So interacting factors at play, and really gives us some room to look at what are some things that we can look at bolstering if we want to continue as a community to help reduce veteran suicide. Now, the Veterans Administration does provide an annual report called the National Veteran Suicide Prevention Annual Report. I wanted to share a bit of data about our 2021 report that we find hopeful and I guess are sort of anchors of hope moving forward in terms of our work in this area. Now, first of all, I shared that over 6,000 veterans died by suicide in 2019, and that is true. But as you'll see from this graph, when we look at veteran suicide deaths over the course of just under 2 decades, you'll see that this number has sort of gone up, some years by quite a lot, some years maybe down a little bit. But you'll notice that from 2017 to 2019, we're seeing a pretty significant drop. And what's really hopeful is that we have seen that almost 400 fewer veterans died from suicide in 2019 than in 2018, which is really, it's hopeful. And we hope to be a sign of the times of years to come. Now, here is a graph that shows the veterans compared to non-veteran US adults. And so veterans are the blue line, and then the US adults population is the orange line. And you'll see that there have been increases in both populations, and both appear to have taken a bit of a dip from 2018 to 2019, which is promising. So this is showing that we, in general, the rate decrease among veterans exceeded by 4 times the non-veteran population decrease. So this is also larger than any observed for veterans in the rest of the period of time that we've been looking at this. And then another way to look at this is we're comparing male veterans and female veterans. So our male veterans would be the top blue line, and female veterans would be the green line underneath. In 2019, there was a nearly 13% one-year unadjusted rate decrease for female veterans, which represents actually the largest rate decrease for female veterans regarding suicide for the past 17 years. So again, we're seeing these anchors of hope. We do also look pretty closely at methods involved to help inform us of what types of interventions would be most appropriate to use with our veteran population. Veteran suicide death by firearm has always been the predominant means of suicide, method of suicide in our population. In the general US adult population, about just under 50% of veterans, 50% of suicides are the result of a firearm injury. And we certainly see that that is a larger percentage when we look at our veteran population. As you can see from this graph, in our male veteran population, about 70% of suicides are the result of a firearm injury. And then in our female veteran population, that has actually risen to nearly 50%, which is a pretty significant jump from where it had been in years past. So we know that targeting our male veterans and talking about access to lethal means and access to firearms is important, but we also cannot discount that we have many female veterans who are also firearm owners and have this highly lethal means in their home. So important to have those conversations with female veterans as well. So I'm saying lethal means and lethal means safety. What is that and what does that mean? What is lethal means safety? In the context of suicide prevention, really what we're talking about is safe storage of lethal means, so anything that could has the capability to end in death. And when we are protecting access to that lethal means, we're building in time and space between when a person first has that sort of thought or impulse about wishing to end their life or wanting to end their life, and then having that ability to act on that thought. So effective lethal means safety education and counseling is something that is a collaborative, veteran-centered intervention. It's a conversation, respecting the important role that firearms and medications and other types of lethal means play in a veteran's life, but also, while being consistent with values and priorities, educating individuals about how that increases their risk when they're in a period of time with increased suicidal thoughts, having that ready access. Now, most suicidal crises are brief. Of course, sometimes they could last longer, but generally speaking, most last minutes to maybe a couple of hours. The graphic here that I'm sharing with you is from a study that was conducted of survivors of near lethal suicide attempts. And the clock symbols are showing how much time went by between when the person had the thought to end their life by suicide and when they acted on that thought. And as you can see, nearly 70% acted within an hour, but almost half in less than 20 minutes and almost a quarter in less than 5 minutes. So time really is of the essence when we are interacting with somebody who is having suicidal thoughts. Anything that we can do to slow things down, like I said, and build in some time and space, really can save a life. Now, the other graphic that I'm sharing, the pyramids, is looking at fatality rates with different means. And as you can see, when a person uses a firearm in their suicide attempt, 85 to 90% of the time, that's a fatality. Whereas if we look at all other methods combined, about 5% of those attempts result in a fatality. So again, really highlighting the importance of thinking about, asking about, knowing about a person's access to lethal means, and building in some time and some space and separation during a time of crisis. So reducing access to lethal means methods is one of the few population level interventions that really has shown the ability to decrease suicide rates. The data and research indicates that roughly 90% of people who survive a suicide attempt do not then go on to die by suicide. So if we can collaborate with veterans ahead of time and help them survive this crisis by talking about lethal means access, maybe doing some reduction strategies, then we've likely prevented suicide potentially for the rest of their lives. For all of these reasons, we at the VA feel very, very strongly that suicide is preventable and preventative treatment works. Every day, people across the nation reach out for support and are able to live healthy, productive lives. So that is what I have for data to frame veteran suicide currently. And then I want to talk a bit about some myths and realities. Because even though suicide is a major public health concern, there are a lot of myths and misinformation about them. And we feel as though if a person has accurate information about suicide, it makes it much easier to reach out to others and help them and feel empowered to be able to do so. The first myth that I would like to address is this idea that people who talk about suicide are just seeking attention. I've heard the term cry for help sometimes. And what we really would like to impart is that actually, no matter how much a person sort of off the cuff or casually or jokingly says things related to suicide, we don't ever want to ignore those. Underneath that could be serious suicidal feelings, and that could have been an open door, open window to inquire and learn more. So we want to be curious, and anyone who's giving us that opportunity, that invitation, provides us the opportunity to intervene before suicidal behaviors can occur. So be curious and check on that. Another myth is that someone needs to be a mental health counselor or therapist to really be able to help someone who's suicidal. And while I appreciate the sentiment, what we have learned over time is that really special training isn't required to safely raise the subject of suicide. And all of us have this ability as humans to be able to connect with other humans. And when we can show someone that we are listening, that we have some genuine heartfelt support when they're going through a hard time, that can make all of the difference in a person's life. And the reality is that not everyone, and I would argue most people, aren't going to seek out a mental health professional for that initial conversation. They're going to seek out somebody else in their community that they know, they care about, that they trust. And so we would ask you to do what you can to be brave about bringing up that subject when you're concerned about somebody. Now, it would be very irresponsible to say, go ahead and bring up the subject if we didn't give you any tools to help you understand what you should do if you're concerned about someone. And so that is part of why the VA has put together the S.A.V.E training. And so I'll tell you what S.A.V.E is now. So it's an acronym. The goal is to teach communities how to help veterans at risk for suicide, acting with care and compassion. The S in S.A.V.E stands for signs of suicidal thinking should be recognized. The A stands for ask the most important question of all. The V stands for validating the veteran's experience. And the E is twofold, encouraging treatment and sometimes expediting getting help. So we'll start with the S, signs of suicidal thinking. Now, our list is certainly not exhaustive. There could be many other signs. These are things we consider to be what are called indirect warning signs. So could be in association with increased risk for suicide, but not necessarily guaranteed. Someone could feel and engage in a lot of the warning signs on this page and not have suicidal thoughts. So important to make that distinction. However, common warning signs including hopelessness or depression, feeling they're stuck or trapped, no reason to live, withdrawing, those are all common, but it's not always depressive type symptoms that we see. Sometimes we see warning signs that look more like anger or agitation or maybe anxiety. Sometimes what we see is sleeplessness. Sometimes it's just an increase in substance use or other risky activities, risky driving or substance use behavior. So any of these things could indicate that a person might be thinking about suicide. However, we have also a list of what we would consider to be more direct warning signs. So things that really are considered the big red flags. So if anyone is presenting with any of these red flag direct warning signs, it's important that we provide some immediate attention. So sometimes that could be verbalizing thoughts or feelings about suicide, could be looking for ways to die, doing some research, asking questions about lethality, could be self-destructive behavior, especially if there are substances or weapons involved. So any of those would require us to move on to the next step of S.A.V.E, the A, which is know how to ask the most important question of all. And that question really is, quite frankly, as clearly as you can state, are you thinking about killing yourself? Now, sometimes that's not the most comfortable way to ask the question for you or maybe for the person that you're with. Sometimes you might want to think about saying, you could use the word suicide. Are you thinking about suicide? You could say, are you thinking about ending your life? So any of those would be appropriate because they're quite direct. They're not vague. We want to avoid any sort of vague phrases like, are you thinking about harming yourself or hurting yourself? Because that might not be the same as thinking about suicide. So just wanting to make sure that there's no question about what it is that you're asking. So you do want to ask if you've identified those warning signs or symptoms. One of the things that sometimes happens is people will say things like, well, you aren't thinking about killing yourself, are you? And I think what's important to note is that if the person were having thoughts about suicide, the message that gets sent is that you're looking for a no, for an answer. Perhaps it sends the message that that's not something you're okay hearing or able to handle. So I always want to try to set up the question as though if they say yes, that's okay. And do try to make it flow in the conversation, sound as natural as possible. You're asking for a reason. You're asking because something made you feel as though you were concerned about their safety. And I think it's okay to acknowledge that You know, like you just said that you weren't sure if you could handle the pain anymore, and you just are thinking that you'd like to be done. Just curious, does that mean that you're thinking about suicide? And it's okay if you are. And so don't wait until to ask the question until someone's halfway out the door. You really want to give some honor and space and time for this conversation as soon as you recognize that something doesn't feel right. And then the V part is to validate the veteran's experience. So if they've just shared with you something that might be the hardest thing they've ever shared with anyone, could be one of the biggest secrets they've ever kept. And, you know, I've always said, I feel honored to be able to have that conversation with people that they trust, that I can hear that, and that I'll listen and be there with them. And really, that is what validating is about. It's about talking openly, allowing that conversation, really being able to listen, be quiet, be there, recognizing that the situation is serious, but not passing judgment, not trying to rush to fix things, not trying to solve the problem right away, but really just being there in the hurt and being present. And also, without trying to rush to fix things, reassuring that help is available and that they are not alone and that you would like to help connect them. So some tips that we have found can be helpful that we'd like to make sure to share is things like remaining calm and listening, keeping good eye contact. It says do not argue. And I think sometimes that requires a little explanation. And I guess if we're thinking from a validating standpoint, our human nature sometimes is to talk people out of things that we think scare us or we think they shouldn't do. And we think it's, that's in a helpful way. We want to try to solve the problem, talk somebody out of how they're feeling, remind them all the reasons why they shouldn't feel the way they feel. And I think there's a time and place for that. But I would say in the moment where the person is really struggling with thoughts of suicide, that can be really invalidating. So we ask instead that you accept that that's where the person is at that point in their lives. Crises are usually time limited, brief. So we're going to try to build that time and space in right here. So right here, when we're validating is when we're building in that time and space, we're slowing down things. We're giving that person the chance to de-escalate, perhaps, and regain that ability to sort of access the part of the brain that helps them make rational good decisions. So limiting the questions, it's not the inquisition, let the veteran do the talking. Be supportive and encouraging, and also honest. Whatever is going on likely didn't happen out of nowhere. Maybe it built up over a period of time. So there usually are not quick solutions, but there is help, and there are people who care and maybe some resources available. Could be mental health related, could be related to financing, could be related to housing, substance use treatment. Lots of different types of solutions and help available. So this is just an example of validation that we'd like to provide just to give a sense of some different ways that people attempt to validate and how some might work better than others. So this gentleman is saying, he's making general statements. Everything's so hard. I don't know how I can keep doing this. And there's a couple different ways that we might respond. And these are both really, really kind and caring people who might respond in these ways. So on the one hand, somebody could say, well, everything is going to be okay. It's going to be just fine. You'll see. And then somebody else could say, well, of course you're overwhelmed. Anyone in your situation would feel that way. And so I asked the question sort of rhetorically, what did you notice? And really what we want to show is that both are kind and caring and coming from a good place in a person's heart. But the first one is really sort of just saying, you'll get over this. It'll be okay. And not necessarily validating how not okay it is right now. So the second option really gives that opportunity to sit with somebody's current pain and acknowledge that, they got there honestly. This is a hard situation. And so really not rushing them to move past that just yet, which is more validating. And then the last step is to encourage treatment and sometimes expedite getting help. So one of the rules about suicidality and about helping people is that there are no keeping secrets. And that's for everyone's safety, for their safety primarily. If someone says they'll talk to you about an issue, but only if you promise not to tell anyone, it's important to be upfront. Let people know that you actually can't keep that, you can't make that promise because you care about them and you want them to get any help that they might need. And you don't want to keep a secret and then regret that you did that. Okay, so let's not leave that person alone. Let's try to get them to seek some immediate help from their doctor or the nearest emergency room. Certainly, you could get some assistance by calling maybe local law enforcement or 911 for assistance getting the person somewhere. They might have a provider that has ability to talk with them. If they don't, certainly you can call the Veterans Crisis Line and have them talk with the veteran, figure out what's going on, see if they can safety plan with the veteran at all, connect them to resources. Now, sometimes we're on the phone with people when they express suicidal thoughts. And so just a note that we're not always in person. Sometimes we just have a voice and we don't know what else is going on, and they might be far away. They might not be in close proximity to us. Key points are really just to keep that person on the line. Don't hang up or transfer, and always remain calm. Try to get as much information as you can about the person that you're on the phone with. So their name, the phone number they're calling from, their current physical location. Where are they? It might not be at their house. It could be anywhere in the communities. And then you could certainly conference call to the Veterans Crisis Line. You could go to veteranscrisisline.net and start a chat with a responder who then can help connect with the veteran. Certainly, you also could utilize local services for wherever area they're in. If the caller disconnects, try calling them back right away. And if they don't answer, then consider having police try to do a welfare check to check on their well-being. But really want to make sure that we have as much information as we can to locate that person who's in crisis, that we can get appropriate services there to respond. Those are all of the steps of S.A.V.E. So we've talked about the signs of suicidal thinking. We've talked about both the indirect signs and the direct signs. And then when to ask the most important question: are you thinking about ending your life? Are you thinking about suicide? And then ways to validate the veteran's experience, not arguing or talking them out of it, but really just sitting and being present and acknowledging that what they feel is real. And then encouraging some treatment. And sometimes if we're very worried and they're not interested or not willing to get help, we might have to expedite getting help and utilize some resources from our community to try to ensure their safety. Now, lastly, I wanted to talk with you about resources available to veterans. Now, I don't have time to talk about all of the resources available to veterans, but I did want to make sure to provide you at the very least with the contact information for our Madison VA hospital, which is called the William S. Middleton Memorial Veterans Hospital. So that is the main facility number, which has a switchboard, can get you to lots of different areas of the hospital. We do have an emergency department. We have inpatient psychiatry, outpatient mental health, homeless services, employment services, social work services, primary care. The list is pretty long, so I can't list them all, but just so you know, that's how you can reach and start getting connected with Madison VA Resources. We also do have a 24-hour telephone triage line available to our veterans who are having any kind of mental health issue primarily. We certainly do get mental health calls there as well. So that number is listed. I also wanted to provide you with the direct number for our mental health clinic. Our mental health clinic does have a same-day walk-in access clinic as well. That's available Monday through Friday. So that's how you could access that clinic. And then, of course, we have our suicide prevention program, which I am a member of. We have 4 coordinators and a community education outreach coordinator. So that is extension 11778 to reach our team. And then, of course, I've mentioned already, but nationally, we do have the Veterans Crisis Line number, which is the 1-800 number, and then you press 1 to reach the crisis line. So this is, the opportunity here is for just the hotline, but also there's online chat or text. I wanted to share, this is a resource that has grown pretty substantially since its first inception in 2007. And as you can see from the timeline, over time we've launched the online chat component, launched a text component, opened several call centers. We recently started doing what's called a caring letters program. So veterans who call the crisis line have some follow-up communication sent to them from the Veterans Crisis Line to encourage them to continue calling the crisis line as needed or accessing care. And millions of calls have been received, 5.6 million calls, more than 1 million referrals to teams like mine around the United States and territories for suicide prevention, and over 200,000 dispatches of emergency services when safety planning wasn't able to happen and that person needed emergency care provided to them to ensure their safety. Over 200,000 seems like a lot, but out of 5.6 million calls and 660,000 chats and over 200,000 texts, I'd say they do a pretty good job of de-escalating and safety planning. And so we want to make sure people know about that resource and utilize it. Now, this is also how you might locate a local VA SPC as Suicide Prevention Coordinator. So that's like what I do at my facility. There are suicide prevention coordinators nationwide, and you can locate them for different areas if you have somebody you're concerned about that lives maybe not in our area, but in a different area. We also want to make sure you know about a website called Make the Connection. And this is an online resource. There are it connects veterans, their family members and friends, and all supporters with information and solutions to issues affecting veterans. So lots of videos, hundreds of videos actually, about different types of challenges. We find that the Make the Connection website is really wonderful for friends and families and supporters to just better understand issues that might be at play with veterans in their lives, but it's also really nice for veterans, I think, too, because it can be really validating to hear somebody else telling a story similar to what your story is. So we would encourage checking out that resource. We also are really pretty passionate, especially given that 70% of veteran suicide deaths are by a firearm, very passionate about promoting issues related to firearm safety, safe storage of firearms, medications, other lethal means. So there is a website called keepitsecure.net that will provide some more information about the importance of this, and that we know that veterans are firearm owners in large part. And then in Wisconsin as well, we certainly see that amplified as Wisconsin has high gun ownership in their general population as well. And so keepitsecure.net is a resource to check out. We also have locally in Wisconsin come up with another resource recently. The Wisconsin Gun Shop Project and Safe Storage Program is another option that is sort of unfolding as we speak. You can go visit their website at betherewis.com to learn more about different area gun shops and retailers who have joined in to provide safe storage options for veterans who should not or do not want to have ready access to their firearm due to their current state of mind and suicide concerns, but they need a safe place to keep that. And so this gun shop project is growing. More and more retailers are joining, and so we hope that this will continue to increase over the next couple of years. We know that some people really enjoy mobile apps to sort of help self-manage different types of symptoms that could be related to their mood. It could certainly drive or be related to suicidal thoughts. Our post-traumatic stress disorder program at the VA has several mobile apps that folks can get for download on their devices for various topics, including insomnia, mindfulness, PTSD, different types of therapies. So we'd like people to know about those. One app in particular that I will highlight is our PTSD Coach app. And the reason I'd like to highlight that is because it has embedded in it a detailed suicide prevention safety plan that the veteran can create for themselves. So signs that they should use their plan, how to cope on their own, some social distractions. It's a really well done safety plan, and safety planning is, if done collaboratively with the veteran in the veteran's words, citing their own strengths and capabilities, can be a very powerful way to intervene in a suicidal crisis as well. That's very much driven by the veteran. So we encourage the use of that app. And then sometimes people don't come to the VA or they don't come to any healthcare, and family members, we want to provide a service and an opportunity, a resource for families and loved ones of veterans to get some assistance in encouraging the veteran that they care about to seek support. So Coaching into Care is a national telephone service at the VA. Really, its intent is to educate, support, empower family members. So we would encourage folks to take a look at that as well and see if they could get some assistance getting the veteran in their life to connect to some care, whether that's through the VA or elsewhere. And then we also have nationally a service for providers who serve veterans. So whether they are serving veterans through the VA healthcare system or perhaps in the community, lots of veterans receive their care outside the VA. But the VA has done a lot of work trying to understand suicide, understand best practices and interventions. And so we do provide free consultation and resources for any provider working with a veteran in the community who they believe is at risk for suicide. So you can request a consult with this program at srmconsult@va.gov, my apologies. So you can just email them and request a consult. We never want you to worry alone. The consult team will help you conceptualize risk, look at different sort of interventions you maybe haven't thought of yet, or point you in the direction of some additional resources. So we want to make sure that veterans, regardless of where they receive care, have the ability to access the best care possible. And then lastly, we do have Uniting for Suicide Postvention. And so postvention are services that are provided to survivors of a suicide loss. And the VA does have a website there, Uniting for Suicide Postvention, that has some really nice resources, some films, podcasts, different sort of data sheets that help those of us in the community to have some good ideas about ways that we can help support our community after the loss of somebody by suicide. And then I think that is the end of the formal presentation. I wanted to leave this open for some questions.
Andrea, thank you so much. That was really wonderful, informative, and the recording of this will be made available to anyone who wants it. Your contact information also will be made available to people following this event and also in the recording. So I know you've said you welcome questions and phone calls and emails. So we want to encourage people to reach out to you. We do have some follow-up questions for you. Thank you for making time. So I think in listening to your and watching your fabulous presentation, one of the things I would really like you to speak to is people are often concerned about confidentiality and making a phone call to what is often someone, especially if it's the first phone call, right? They're worried about what's going to happen to their information, who that stranger is. Can you speak to sort of just encouraging family members, friends, and veterans themselves to make those phone calls?
Yes, thank you. That's a great question. Confidentiality is a really important part of healthcare and mental health care, and it's not taken lightly. It's taken quite seriously. When a person is concerned about their own safety or the safety of somebody else, we take all of those very seriously. There are always limits to confidentiality, and so I feel like I would be remiss not to share that. Certainly, due to federal and local laws, there are requirements that if we do believe a person to be at imminent risk to themselves or others, that we do have a responsibility to share that information limitedly and limited amounts of information for the sole purpose of maintaining safety for that person and the community. So it is possible that if we felt as though somebody were at imminent risk for suicide, that we would need to, like I said, contact perhaps law enforcement for a welfare check, providing limited information, only what's necessary in order to help that person get to a safe resolution.
Mhm.
But generally speaking, imminent safety is a pretty high bar, and it's a pretty high bar in Wisconsin, certainly. So lots of steps are taken to respect the patient's right to confidentiality, to meet them where they're at in terms of what they're interested in, what they're willing to do. And really our main goal is to encourage connection to resources voluntarily, because we do very much believe that voluntary engagement in care is most successful. Does that
Thank you.
answer the question?
Yeah, no, that's great.
Great.
I think in a related way also, the evolution of gun shops accepting firearms for safekeeping voluntarily from gun owners is a really important element of this. And I think particularly given your emphasis of the presence of firearms in the hands of veterans, that, and in Wisconsin, of course, right?
Right.
So can you speak to the confidentiality piece of that and how that works for someone who wants to hand over their firearms? Are they losing them entirely? Is there any chance that they will be kept? And how can they get them back if they want to hand them over, if they're concerned about their own safety?
Thank you. And I am not an expert on this area, but what I do understand is that these are voluntary programs where the veteran voluntarily turns over their firearm to the participating gun shop owners. Often there is some sort of a agreement or system in place at those different gun shops where perhaps they might want to have someone vouch maybe that everything's good to return this. I don't think that they would ever have the ability legally to keep somebody's firearm unless there was some legal reason why they couldn't own the firearm. And there are very few legal reasons to not be able to own a firearm. So the intention and hope of these projects is not to permanently take firearms from the hands of firearm owners, but really only temporarily and voluntarily while that person is in an enhanced sort of state of crisis.
And so I'm sorry that I asked you a question that you didn't have the full answer to, but I want to say two things about this. One is that there will be a webinar coming up in this series specific to gun owners and also safe storage. And one of those gun shop owners will be a part of that webinar, and that will be happening probably late summer, early fall. The other is there is more information at the S.A.V.E Communities website, which will show up on a footer shortly. So thank you. But thank you also for raising that in your presentation, because I do think it is, I think people don't often know what to do, right? And so just knowing. Mm-hmm.
They don't. And we had the wonderful opportunity to take part in something called the Governor's Challenge, which was a collaboration between the governor of Wisconsin and the Department of Veterans Affairs, both with Wisconsin and the National Department of Veterans Affairs, and then lots of community members, stakeholders. And one of the wonderful things that came out of that was really this BeThereWith.com gun shop project safe storage program, which latched onto what S.A.V.E Communities has been working on as well. So really just looking to expand that beyond Dane County and through the entire state.
Thank you.
Yeah.
So as your next door neighbor at UW Health. I'd like you to speak to, all of the work all of us do these days is dependent on strong collaborations and on good partnerships. No less this topic than any, right? So what can more of us do that you wish we were doing, whether it's healthcare or community partners or mental health institutions and organizations, people who are in a position to screen for suicidality or risk, anything you can imagine, including maybe Veterans Affairs?
Yeah. Great question. I think really looking at this as not an isolated certain population issue, but really this is a public health issue, and handling it in a way that we handle other public health issues with universal approaches. And so I think, we need to have sort of the universal approaches that to screening for suicide across all different types of settings, and really have people get comfortable asking questions about suicide to our population and to the population. And then when we recognize folks who are sort of at risk, I think then we have some more targeted things that we would like to promote more people and more organizations doing. Including within the VA. I mean, it's always a work in progress, but safety planning is a really mindful, collaborative intervention that helps you make a connection with the individual and helps the individual make a connection with themselves about what it is that they need. And so, we would certainly promote, when we recognize at-risk populations, let's safety plan. Let's show them how to do that. Let's give them the tools to be able to be more self-aware, so they are able to also help themselves in a crisis. And then I think in general, let's not be siloed. Community engagement is huge. And so one of the things that the VA is doing currently, and we do have this position filled at our facility, is we've added a community education and partnerships coordinator. So this person is a member of our suicide prevention team, but they're in the community. They're out there joining coalitions. They're out there standing up new coalitions in our catchment area, which is pretty broad, far beyond Dane County. Really with the express purpose of preventing suicide and ending suicide. So when we work together, we can do so much more than when we all try to work alone. And so I would encourage folks, if they're not a part of a coalition, if their organization is not, to seek one out. If they want to work on veteran suicide prevention, let me know and I'll connect you to our community education partnerships coordinator. And so really having the efforts of many put forward together can be really impactful. And then the gun shop issue, right? Let's talk about lethal means, having that conversation. Some people feel it's a violation of privacy. They feel like it gets into the issue of whether about gun rights and gun ownership. And it's not about gun rights and ownership. It really is about making sure we can keep somebody's environment as safe as possible during that brief period where they're really struggling and at risk for suicide. And so ways that we can partner in a way that is respectful and to the individual, maintaining their rights, and and then post-vention support is another one I'm a big supporter of. I think we as a community can also do more to make sure that in the tragic event that we lose somebody to suicide, which if it didn't happen, we wouldn't be talking here today, right, Mary? So in the event that happens, we have to take care of the people who are left behind. We have to take care of the people who have survived that, help them understand how to best move forward and care for themselves.
That's fabulous. You've done such a wonderful job and service today, but in an ongoing way. And again, anyone has questions about any of this, they can reach out to you and S.A.V.E. Communities. And thanks so much. Thank you to everyone involved with today's webinar and the series.